Hi, welcome to Aging and Learning. I'm Beth Heitzman. This is a community where we talk about aging and learning. Maybe learn some new things and maybe challenge some things that we have been taught, especially in the mental and the physical healthcare world. So I don't know about you, as I started getting older, for me it was after I hit 60, I started noticing some changes in my body. I was having some more aches and pains. My vision was getting a little blurry, just like brain fog. And when I talked to my doctor about it, she would say the typical answer I get for someone over 60, well, these things happen with people your age. And if you listen to me at all, you know, I started challenging that concept. Really, does it have to happen just because I'm getting a certain age? So I started doing research. And one of the things that kept coming up for me was chronic inflammation. And then it was really driven home. My husband had gone to the doctor, and the doctor didn't see anything, and he ran some tests, and he saw on his lungs what he called shadows. So he sent him to a specialist, a doctor who specializes in cancer and other things, because they wanted to see what the shadows were. My husband also worked in a foundry for years and years and years, which was not the healthiest environment to work in. So as we met with the doctor who was specializing in these shadows in the lungs, one of the things that he said to me that really struck home because of what I was researching for myself was, things like cancer and the lung diseases and stuff usually come down to glucose and chronic inflammation. So there is that word again, chronic inflammation. So as I did some more research, I learned that chronic inflammation, some say that it's the cause of everything. Some say, probably not the cause of absolutely everything. But most professionals that I've researched agreed that chronic inflammation was at the root of almost everything that happens in our bodies. And I thought, this is something I really want to look at and take seriously. I'm looking down a little bit because I got some notes because I don't want to lose my thoughts, because I'm just one of those hyper people that I will go, oh, look, a squirrel, and go off on a different tangent. So if I'm looking down at my notes, I'm just trying to figure out where I was at. Okay, so we were talking about chronic inflammation is the cause of the vast majority of the diseases. And I'm going to read this list on my computer, including heart disease, cancer, diabetes, autoimmune disorders, neurodegenerative diseases, and then also, here's the old age stuff coming in, chronic fatigue, brain fog, mood issues like anxiety and depression, eye problems, and skin problems. And the list goes on and on, what the doctors and the experts are putting down to this thing called chronic inflammation. So I had to look at what was chronic inflammation, what was inflammation, and I learned that inflammation is not necessarily bad. There are basically two types of inflammation. There is acute and chronic. So acute is normal inflammation. So like when you fall and you break a wrist or you get a scratch, your body's going to produce this acute inflammation, which is really healthy because it is the inflammation that cures it. You know, even when we get fevers and stuff, it becomes inflamed, and it's the healthy thing that the body does. But what happens is when chronic inflammation starts happening, chronic inflammation basically, okay, so I'm not a doctor, I just do a lot of research. I have to speak in language that works for me, so that's how I'm gonna spit it out. So chronic inflammation, basically, it is when your body gets in a state of confusion, and the inflammation, instead of healthy, is really now attacking things. It's become very, very, very harmful. So what causes this chronic inflammation? It can be anything from the environment, toxins, obesity, like processed fried foods, excess food, smoking. There's just so many things that are causing inflammation. So what I had to do in my life is look and say, okay, where was this inflammation coming from, and what can I control? Sometimes things out in the environment, I can't control it, but what do I have in my control that maybe I could help control the inflammation? And I realized for me, a lot of it just came down to my diet. What was I eating? Was I eating things that was causing inflammation, that was causing brain fog, that was causing the aches and pains, that was causing things that they were putting down to aging, was it actually to my food? So I decided to figure out and do some experiments with that. I've done everything from vegetarian to the American Diabetes Association, because that's what my doctor had recommended to me. But then I found a process called therapeutic ketosis. Sometimes it's called prescription strength ketosis, but it was really known to help stop and even reverse the problems of inflammation. So I went with that, and luckily for me, it really started working. My aches and pains started going away. Weight loss, I think I've lost about 30 pounds, but this was the first time in my life I went on a diet, and it wasn't to lose weight, and that wasn't my main goal. Obviously, losing weight I think is going to make you healthy as you get to a healthier BMI, but I was more interested in stopping what I'm seeing as people, what happens with the aging process. As I watch my mother-in-law, as I watch other people who are my age and even older, just going through issues, and I wanted to do everything I could. No diet is gonna keep you alive forever and make you like a 12-year-old, but I wanted to give my body the best chance it could to live a healthy life. So I'm just putting this out there for you right now, if you're in this journey along with me, and you're starting to have aches and pains, maybe blurry vision, maybe anxiety and depression. I was on depression medication for a long time, and I didn't really think about it till I talked about it now, but I've gotten off all my medications. I'm feeling healthier, I'm feeling younger. So if you're dealing with some things with aging, take a look and highly suspect chronic inflammation. What I would suggest doing is look into a therapeutic or prescription strength keto diet. Now, so there's a lot of internet keto out there, so that's not what we're talking about. I invite you to maybe research doctors like Dr. Boz, Dr. Chafee, Dr. Ken Berry, Dr. Westman. There's so much advice on there on how to go to therapeutic prescription strength keto, and basically in a nutshell, you eat mostly meats and you eat less than 20 carbs. It's the 20 carbs. All the doctors have maybe a little bit differing opinions on what exactly works, but I think they're all in agreement pretty much so that 20 carbs is the cure. So wrap it up. If you want to reverse diabetes, at least for me, it worked for me. I was told that once you get diabetes, you can't reverse it. Other doctors are saying, no, that's not true. And in my case, I found it's very not true. My husband was diabetic, and we asked the doctor, just please let us try something before we do it. Now he's testing, his numbers are great, his numbers are positive. So instead of blaming everything on aging, like the medical world wants to do, which gets us on all kinds of prescription drugs, it's one after another, maybe try something like therapeutic ketosis. Is that right? Yeah, that's it. Let's go with it. But thank you for being with me and joining this community where we are aging and learning together.